everyone. Welcome back to Make Some Plans. I'm one of your hosts, Kelly.
I'm your other host, Angelo.
And today we have a very special guest, one of my best friends from college, Tina.
Hello.
Where are you based? What are you doing now? And we'll go from there.
I'm Tina. My pronouns are she, her, hers. I'm currently based in Nashville and I'm a labor and delivery nurse.
Let's get to know about your education background.
I went to UC Irvine with Kelly and I actually started out at UC Irvine as a nursing major. I had to switch out my second year because I got past biochemistry. It's really hard at UC Irvine. Kelly knows this. It's not easy. And they were like, you have to change your major after like one class. And I was like, okay. So I ended up going into public health policy, which I enjoyed. I'm happy I have that like public health background. I learned a lot about that aspect of the health industry, but I knew I wanted to go back and get my nursing degree. And so after college, I worked at a senior living facility by my home in San Diego while as like an admin assistant while I was taking some more prerequisite classes for accelerated nursing programs. And so I took like a year or two off doing that. And then I started an 1 year accelerated nursing program at a small Catholic school in Louisville, Kentucky. Graduated from that about a year ago, or actually, yeah, like a year ago, and then passed my NCLEX a year ago, and here I am.
That's a very like broad overview of your journey to nursing. So let's kind of like zoom in a little bit. So let's just kind of like start from the beginning. Did you always know you wanted to be a nurse?
I wasn't like one of those kids that was like, little kid and was like, I want to be a nurse. I didn't really figure it out, or I didn't figure out that I really wanted to be in the healthcare field until high school. We, especially our sophomore year, we focused a lot on like career aptitude in our classes, and everything I was taking said I'd be really geared toward the healthcare field. And the more I thought about it, the more I'm like, I like working with people. I like helping people. I always been interested in the healthcare field. But all those aptitude tests and whatnot kind of made me realize like, oh yeah, this is what would interest me the most and work best with my abilities and whatnot. I originally thought like, oh, maybe I want to go the doctor route, but I didn't really want to do like 4 years of medical school and then all the residencies. And plus as I looked more into nursing, I liked the flexibility of nursing a lot more. And I liked how nursing was more hands-on than the doctors really are in some cases. So that's why I went with the nursing route.
Was there any inspirations that influenced you to be like, you're definitively saying, yes, like this moment in time, I want to be a nurse?
I think a big one kind of was when my dad had open heart surgery back in January 2013. So it was like January of my junior year in high school. And, just seeing how much, the nurses like were really there and like took care of him and, really helped him get back on his feet after a major surgery on that. They were always so kind to us, because that was back when you could stay in there forever with the whole family. So I probably say that was like a big thing. Like, okay, yeah, this is the career I want to go and how I want to help people. And
I agree. I actually like I've known, when my grandpa is in the hospital, and then historically, like when I visit him in the hospital, it's always like the nurses who are actually there, and you're like interfacing with them, and you're talking with them, and they're making your family feel welcome. Like the doctor really only comes in like, once in a blue moon, but you're really seeing the nurse like daily. So I can see how that's like a very big influence. We wanted to really get in perspective on your path to nursing, because we know that there's different pathways. Obviously, you can go straight to a nursing program, like what you initially did. And then you can also just major in undergrad in whatever major that's applicable. And then you can take prereqs and then maybe go into a program after that. So I was wondering if you could kind of just lay out some of the popular general pathways to nursing.
Yeah, sure. Well, a big thing is first like to figure out, I'm going to be mainly talking about like the RN or like registered nurse kind of
Right.
pathway.
Yeah. Okay. So
There,
RN.
right. There's also like LPNs, licensed practical nurses, which is a different pathway. So I'm going to be mainly focusing on the registered nurse pathway. So the big kind of popular ways are either starting out a 4-year university straight out of high school into a nursing program. That's a main popular one. Or and then the other kind of big popular one is majoring in something else and then going on to do an accelerated post-bac program. And then the accelerated programs, I did one where you just got your BSN out of it. Some you get your BSN and your MSN, your Masters of Science and thing, out of it as well. But most are you just get your BSN. And then there's also pathways for if you got your LPN and want to then they have bridge programs from LPN to RN programs. So those are kind of like the three big most popular pathways. Some people also like they start from like, I mean, you can start from like the way like CNA to LPN to RN or like CNA to RN. There's really a lot of different, based on your situation and circumstances, a lot of different ways. But I would say like the two main ways are straight out of high school into a 4-year undergrad program or a post-bac accelerated program.
And at the end of either of those pathways, you would take the test, right?
Right. The NCLEX, which
NCLEX. And that allows you to get your license to practice as a registered nurse.
Yeah.
In the beginning, you talked a little bit about your journey to going to nursing school. So you went from California to Kentucky. How was that like for you to almost move across country?
It was definitely a big step because I had never lived anywhere outside of Southern California beforehand, but I knew it was a big opportunity. Couple main things was the program was only 1 year long compared to 16 to 24 months, like most programs are, especially here in California. So that was a big kind of draw. I knew I was like, okay, I'm going to be moving far away, but it's not going to be for very long, for one. And two, there was actually, it helped when I got there. There were a lot of students who were also from California, actually, either California or New York, not from Kentucky. So we all kind of helped each other acclimate and were each other's support systems. So that really helped. But yeah, it was definitely a bit of a culture shock at first. But being surrounded by a bunch of other transplants in this very intense program and environment, you kind of, this sounds bad, but you kind of like didn't really have didn't have time to be like homesick. Your life was nursing. And that's the case with these accelerated programs. Like you cannot work there, it's very, very hard too. You're solely focused on the program. So it was it was intense, but it was also helpful because it distracted me from like being homesick.
How was the program structured?
My program was structured into 6 10-week sessions. We took 3 classes a section. The last 2 sections, one of our classes was NCLEX review. So that wasn't really like a class. That was more of just a specific time where we got to do like test, NCLEX style questions, go over NCLEX strategies, stuff like that.
What's like the typical day of a nursing student? Are you in a classroom a lot? Are you also doing a lot of practical work?
It depends. I should have like looked back at my schedule, but I think I had about like 2 to 3 days of lecture and then a day of clinical. So clinical is when we were on site at a hospital for 12 hours and we would follow a nurse around and learn that way. And as like we progressed through the program, we got to like do more things. Like our first clinical, we really couldn't do anything, but then we got to a point where we could like do certain skills or like help pass out meds with supervision, obviously. So those are like the 2 main either lecture or clinical days. And then we also had like skills day where we would get checked off on skills like putting in Foley catheters, putting in NG tubes. And then also once every section, we had a simulation day, and that changed throughout based on like feedback and whatnot, but basically it was a sim day put on by the lab team, where we would have either the like the robot mannequins or like live people trained to be fake patients.
Like actors.
Right. And like your whole class would be watching you, and it was like low key really intimidating and scary. But so those are kind of the days, and then studying before and after tests, and yeah.
That year probably went by so quick because you just had no time to do anything but to
For
eat,
sure.
sleep, nurse.
For sure. We didn't do a lot of things in Louisville because we're like, oh, we gotta, we'll do it next year once we're done with school. And then like COVID happened. So didn't really pan out exactly as planned, but it went by super, super fast.
What are the different types of specialties that nurses could go into, or what type of departments most nurses work in?
So that was the other thing that really drew me to nursing, is that there's just so many different avenues. I mean, I'm currently what's known as a bedside nurse, so working in the hospital at the bedside, and that alone, I mean, you can work in, labor and delivery like I am, or med surge, ICU. You can focus on cardiac. You can go into psych nursing. Like there's so many areas of just bedside nursing alone. And then if you want to get away from the bedside, you can go into like nursing management. Lots of people go on to grad school to get their like nurse practitioner, either their family nurse practitioner or like acute care nurse practitioner. So there's even subspecialties with that. Trying to also think, you can, if you want to stay in the hospital, you can move up on your unit and become like a charge nurse, or a manager on your unit. There's just lots of different fields. You can still work as a nurse, but like not in a hospital, like as a school nurse or just at like a clinic. Lots of different areas.
Yeah, it seems like there's so many different options that this profession can take you. You could get more schooling if you want, or you can be in a leadership position, even in a smaller clinic setting. There's just so many options.
Right. There's really something for everybody.
And I was wondering, like, when you're going into a specific avenue in nursing, how flexible is it within the middle of your career to change?
To be honest, I would definitely say it's pretty flexible. When you graduate nursing school, you graduate as what's called a nurse generalist, so you can work in any specific field. My first floor I worked on was a cardiac step down, and then I actually left after like only 7 months to do labor and delivery. And it's an adjustment at first because you're so used to how your unit runs things and what you did with that population of patients. So when you switch, you kind of have to like go back and think about your new population of patients, what their needs are, how your new unit does things. So it's a little bit of adjustment at first, but after a while you get used to your new job and your new role. So I would definitely say it's pretty flexible, depending on how. I mean, it's definitely more of an adjustment if, let's say, you're in one career for like 10 or so years and you want to switch over. It could be a little bit, like I said, more of an adjustment. But I know people who have done it, and they ultimately really enjoy it. So I would say it's pretty flexible.
What's the training process like to go from one specialty to another?
Every unit has an orientation process of about 12 weeks. At least that's how long both of mine have been. And if you need to do, like, I actually did 13 weeks. Some people do an extra week or two just to like hone in on like either a certain situation or a certain patient type that they haven't been with, or like just become more comfortable on the floor. But usually about 12 weeks. And depending on if you've had experience on that like type of floor or not, kind of depends on like the type of preceptors you get. Like for labor and delivery, for example, most people switch into labor and delivery from completely different floors. So most people don't have labor and delivery experience when they start, and they know that. So they're a lot more patient with you. and know that it's a very whole different ball game, essentially. You know, everything is so different compared to other nursing floors. So usually it's about a 12-week orientation with different preceptors. And yeah, regardless of whether you were a nurse before or not.
What made you pick that specialty in nursing?
I've just always really liked the environment, and I remember during my L&D clinicals in nursing school, I really liked like labor and delivery is a very what's the word I'm looking for? Like everyone helps each other out. Like you don't feel like you're never alone in a birth. You're never alone in situations. Like everyone's even willing to like help you with like fetal strips, you know, fetal heart rate strips. Like it's a very collaborative. That's the word I was looking for. It's a very collaborative environment. And I just love like the adrenaline of like births, and like you never really know what's gonna come through the door, which is also exciting. It's not my last job on a cardiac step down floor was a very like same, kind of got tired and bored of it. Whereas this is a much more exciting department.
As working there, increase your appreciation for babies?
Oh yeah, I mean, moms. Oh my god, because the others. I mean, I love labor and delivery, but it can go from 0 to 100 very quickly, and you have to be prepared and update your charge, update everybody. You know, get the right people to come help you as well. Moms go through a lot when they give birth.
So what's a typical day like for you to work as a labor and delivery nurse?
No, it depends. So usually, come in and I'll have, depending on the day, I'll get 1 or 2 patients. Sometimes it'll be a patient that's already there in labor, or sometimes I'll be like getting an induction that's going to be starting at 8 p.m. So if I'm getting an induction, I'll make sure my room is set up, go over her history, start filling out the paperwork that we have. And then when she arrives, get her set up, start an IV, get baby on the monitor, get labs, do our admission navigator, and then go throughout the labor process from there. If there's someone who's already in labor, I'll just continue on with what, her process, what's been going on. And then if I have a birth, I call the doctors, call everybody. Sometimes we do call NICU to births, depending on the situation. And I help mom push throughout the time, throughout her labor. And if I'll call the doctor right as we're crowning and we can like see baby's head. If it is a patient who's had multiple babies, I always ask like, how long did you push with your previous babies? Because if they say like, oh, I only pushed for like 15 minutes, then I will call the doctor like right when she's complete, because it's gonna go very fast, Whereas a first time mom, it can be like 2 to 4 hours of pushing before we give birth. So that's kind of that. Sometimes I'll start magnesium, different drips like magnesium drips, insulin drips, and monitor throughout with those. Sometimes we'll usually after birth, if everything goes well and everything's good, they're with us for an hour, which I'm in charge of rubbing the belly every 15 minutes, going through the process of recovery, and then bringing them over to the postpartum mother baby side. But sometimes we have to keep them afterwards for various reasons. So monitor them postpartum. And sometimes we do have to have, since I work nights, none of our C-sections are scheduled. So if we have to go for a C-section, it's an emergency. So if we're calling a C-section, pulling all the IVs, get it running over to the OR, getting everything prepped, again, calling all the right people to come to the OR. And when I'm doing a C-section, I'm more of like an OR circulator kind of. I give supplies to the surgical techs. I do counts with the surgical techs, and just kind of circulate throughout the OR and keep tabs of all times, et cetera, et cetera. Sorry, this seems like a lot of information.
No, this is good. We want to know like what happens, because it's so interesting. We never hear about this stuff and we don't know what nurses do, or, and it's really eye-opening, because it seems like your day is just it's so busy. It's go, go,
Right.
go all the time.
Right. That with labor and delivery for sure, like there's very rarely like a downtime. I would say the most downtime is when I'm starting inductions, especially if they're not already in labor, because it kind of, we give certain meds and whatnot to kind of start labor, but sometimes it can, kind of take a while. So that's like the most like downtime I would say, but usually there's like no downtime. We're constantly monitoring, constantly watching baby strips for heart decelerations, turning mom in certain positions to get baby to either move down or switch positions. So yeah, that's kind of an overall of how my night could go. And sometimes I'll get patients that come in through triage. So sometimes like I'll be, give off my patient a postpartum, and then my charge will call and be like, oh, we have a patient for you in triage. I'm like, I just got rid of my patient, but okay. So yeah, you kind of just have to be very flexible and open to different possibilities and different ways of how the night's going to go, because you truly don't know what's going to walk through that door.
Yeah, it seems like you're running around a lot and getting involved in a lot of different tasks around, the floor. So you kind of just mentioned like, oh, I just finished with this patient and I sent them off, but you just have another patient that's coming through. Let's say there's like a bit more of a time gap. I don't know if you could even call that like a free time, but are there like downtime responsibilities that a nurse is responsible for?
So usually my downtime, like if I give a patient, hand off my patient, I'll usually finish up like any extra charting I had, because sometimes you get so caught up in like doing your tasks, like you do a lot of back charting in labor and delivery. So I'll catch up with that. But if I'm finished with it, I usually kind of start cleaning out my room just to help the custodial team out, getting our carts back into the supply room to be refilled. And then I'll help. At that point, we call ourselves like a duck. So I'll help out any of my other coworkers, with like passing meds, or if they need help, they need me to grab things, like I'll go do that. So yeah, usually just helping out the rest of the team. And if you have real downtime, you're supposed to be doing your learning exchange modules, but that's very rarely.
What is that? What is your learning exchange modules?
Learning exchange modules are these, and you have so many when you start working at a new place. They're modules that you have to complete. Some are based on the unit, some are based on the hospital, and some are like general HR, harassment ones based on the company. Yeah, they're just like these educational modules that you have to complete by a certain time, and you're supposed to get paid for doing them. So they prefer you to do them while at work, but you don't always have time to do that. So
I want to ask a question where, in medical shows, there's always chaotic things like, oh, a patient is coding or whatnot. Do you see a lot of emergency things, or is it just mostly for the drama on television?
So definitely at my new job, we have such a high acuity patient population. We get like the sickest of the sickest moms. So for us, it is not uncommon to like roll back to the OR for an emergency. But then on some, like on my last floor, I only saw, in the 7 months I worked there, I only saw like a couple codes. And then I've heard on some labor and delivery floors on like smaller hospitals, they very rarely have to go back to the OR. So it really just depends. Unfortunately, like I said, I've seen emergencies that happen. A big one also for us is a postpartum hemorrhage, which is excessive bleeding after birth. I didn't have any on orientation. And then my first month off orientation, I had 3 patients that had a postpartum hemorrhage. So that was kind of stressful, just because I obviously had gone over what to do with like my preceptors, but I had never truly been in it. And like my first one, the doctor said we need to set up a Bakri balloon, which is like this big balloon that they put up into the uterus to help keep the uterus contracted to prevent bleeding. But I had never had a patient with a Bakri balloon. I never set one up. So I'm not going to just wing it. So I had to ask the doctor, I'm like, I have never put in start a Bakri balloon. You have to tell me what I have to do. And she's like, okay, get this. So that was so stressful because I had never been in that situation. But again, everyone is there. You just have to not wing it, know when to ask questions, know when you don't feel comfortable in something and need help. That's a big thing, is know when to ask for help.
Do you want to go into more of the kind of attributes that a nurse should have on the floor? It sounds like, definitely taking initiative and want to do that. asking questions when you need help, anything else that you'd speak highly of?
Yeah, the big ones are like always asking questions, asking for help. Like even if you think it's a stupid question, it is so much better to ask than to just wing it and then be wrong. You know, no one is going to fault you for okay, I say no one is going to fault you, but there are some, let me go back in the day, there used to be this nurses eat their young kind of mentality where the older nurses would essentially kind of bully the younger nurses, and the motto was like let them run free and figure it out, you know. But over time, that is obviously like not the best way to foster new nurses and go about doing that. I'm not explaining. I don't know if I'm explaining that right. But that doesn't really happen anymore. Nursing has definitely become more of a supportive, enriching environment. But unfortunately, you might experience some nurses that still have that mindset. So you have to kind of have a thick skin with those kind of nurses. I will say if you are in a unit that you don't feel comfortable in, that you don't feel safe in because you're afraid to ask questions, they don't feel like they're going to help you, then I would leave, because you should never ever feel like that. And there are so many units that aren't like that. I didn't realize how much bullying was on my last floor until I moved to this floor. You know, I thought what I had experienced was like the norm, but it's really not. So never be afraid to leave, even if it's, you know, within the year, you know, if you haven't hit your year mark, if you're not happy and you don't feel, you know, supportive, it's totally okay to leave. And going with that is knowing what works for you, if you're not happy at your job, your patients can sense that. Advocating for yourself, asking questions, taking initiative and being an advocate for your patient. That one can take time because especially as a new nurse, you don't always feel comfortable taking certain initiatives, especially with doctors. So that one can take time, but if you're always advocating for your patient and what they want, that is going to make you a better nurse. And just being flexible overall, no matter what unit. You're going to get admissions, you're going to get switch patients around. Being flexible, being on top of your work, staying organized is a big thing as well.
And by advocating for your patient, you mean listening to what they want and conveying that to like a doctor or whoever?
Exactly. Or if the doctor suggests something that you don't think would be the best thing for your patient, because you're the one that's with them 12 hours of the day most of the time. It's a little bit different with labor and delivery, but on most floors, the doctor's there for like 5 minutes. So if they're suggesting something that you don't think is completely right for your patient, kind of ask them about like, hey, what are your, like, this is what my patient wants, that you're suggesting this. What are your thoughts on suggesting this? And kind of having a conversation.
How has the pandemic changed how you work?
Well, the thing is, I started working in the nursing field in June of 2020. So all I really know is nursing in a pandemic. But some big differences from I remember with clinicals were, I mean, obviously we still have to wear masks. I know the mask mandate is gone with a lot of businesses and places, but we still have to wear masks throughout a whole shift. The visitor policy was a big one. For a while at my old hospital, we had no visitors allowed, or just one visitor for your whole stay. Also, with like the beginning of the pandemic, the constant changing of policies regarding if you were, with someone who is infected, how to go about that, if you're asymptomatic, when to get tested, certain protocols for infection control if you have a patient that was infected. That was constantly changing as we were learning new information. So again, staying flexible and being open to the new policies, and just a lot of change in that regard. But again, I only ever knew really what it was while in a pandemic.
Is there anything else that you kind of wanted to speak about regarding your nursing journey?
I think a big thing is nursing school is hard. It's really hard. You're going to have some high highs and low lows. But if this is something you really want to do, don't give up on yourself. There are so many different pathways. And if you just don't give up on yourself, I mean, I had days where I wanted to quit. I was like, I'm done. I'm over this. But you'll get through them. It's meant to be hard because it's going to prepare you to be a better nurse in the future.
Do you probably think about certain ideas or reasons you went into nursing? You think back to, like, I guess, helping people, right? because that's like what it is at the end of the day that helps you through the job.
Right. And it's very easy, especially on like long shifts, to kind of forget that. But if you just take a second to remember like why you're there, at least for me, it helps. It helps. Because if you forget why you're there, it's very easy to get stuck into nurse burnout, as they call it. Taking a minute to remember why you wanted to be a nurse, and also taking care of yourself. Taking care of yourself is a big thing that nurses forget to do oftentimes. And that's something I'm still working on, because it's very easy to get stuck in a work, sleep, eat habit and not really take care of your health, your physical health and your mental health. But that's just as important, because if you can't take care of yourself, how can you take care of your own patients? So just keeping all those things in mind.
What does it look like for you to take care of yourself?
Well, for me, and this was especially when I was first a nurse, it was really hard for me to leave my mistakes that I made and even for me, I'm very hard on myself. So even something like so simple that doesn't affect anything, I would really take to heart, and it would like I would go over scenarios in my head of like, did I do this right? Did I do this right? What could I have done better? And while that's good to like reflect on your work, it can also kind of be toxic if you do it too, because for me it was causing me a lot of anxiety at certain points. So leaving my work at the door was a big thing that I had to work on, and I'm still working on. And then just, this sounds really dumb, but like I work nights, so it's very easy for me to like sleep all day and not really get anything done. So trying to break out of that habit of just like either not going to bed right away and like going to the grocery store, or just taking a second to like watch some TV or clean some parts of my house while listening to a podcast, and just taking some time to get things done. Because I know for me, if I work multiple days in a row and just not get anything done, and my apartment becomes a mess, and I just end up getting more anxious and stressed because my environment is such a mess. And by the time I do have a free day, I don't really know where to start keeping up with the daily things, simple self-care things that seem so hard in the moment sometimes to do, but are definitely worth it in the long run.
It's great to hear that you're taking the steps to take care of your mental health. Kind of expanding on that, we've talked to some people who've moved across the country for their professions or for school. I'm also moving out of state. It's not as far, obviously, as Kentucky, but it's still like a ways away from home. So I was kind of wondering if you could expand on that experience of moving out of state for the first time. It can even be from a scope not a scope away from nursing, just your daily life of living outside of the state.
Right. Yeah, well, a big thing is like, and this can be hard, but like trying to keep in touch with friends that you had made, back home, keep in contact with, and still have that like little piece of home that if you feel homesick, you can call or text them. And it's hard to make friends as an adult, but like kind of getting out of your comfort zone and try to make friends in like your new city. I did Bumble BFF for a little bit in Nashville, which is a fun, it's a easy kind of way to just like meet new people, but also like a big one for me was like becoming friends with my coworkers. It's like be like, hey, do you want to get breakfast after work? Or hey, I'm free Tuesday. Do you want to go get like a drink at happy hour? Little things like that. It's not easy. It's definitely not easy at all. But especially if there are multiple people moving from into the new city from other places, they're more likely to be open to hanging out and making friends. So
because they're all in like the same position, right? As you.
Yeah, and I definitely think it's harder as an adult in the working field. Like I said, it's mostly like coworkers and whatnot than like in school. In college, we're all in this structured environment, and you're forced to hang out with people, and you're essentially forced to to make friends. And then same thing with like graduate school. Again, everyone's in this environment. Basically, you're all stuck in this academic environment where you have to go to class with people, and you have to do projects with people, and so you naturally make friends that way. Whereas in the adult working world, you kind of have to do a little bit of like, it's not so structured like that. But like I said, getting out of your comfort zone, inviting people out after work, or joining apps like Bumble BFF, but it takes time. But it works out.
Yeah, that's awesome. I appreciate that advice.
Yeah, you'll be
Yeah.
good.
What is some advice for people who are interested in the nursing profession, but they don't know if this is for them?
I would, if you're able to, especially with COVID restrictions still kind of in place at the hospital, it would definitely depend on where you're living and whatnot. But I would, if you can, like shadow a nurse, if you know someone, and just to see what their daily shift is like. I know there's also some programs. I know my local hospital had one for high schoolers who are interested in the healthcare field to do an internship with the hospital. And that's another awesome way to see just not only how nurses run, but what healthcare is like in general. So if you have something like that in your area, I would definitely look into it. Those are kind of my two big things, like shadowing and finding internship opportunities to get you access to the healthcare field.
What are some things that you would want a medical student to know about the relationship between nurses and physicians in a hospital? It's all a collaborative environment and we're all professionals, but I think it's important for medical students to know like certain things or expectations that they should have working on a team with nurses. So what are some things that you would want a medical student to really know?
I would definitely say to just have, keep the same respect for nurses as nurses have for you and how you have for your coworkers, just because some unfortunately do not have that same respect. At the end of the day, we're all working towards keeping our patients safe and healthy. You might, as a medical student, might be looking at different things that we as the nurses are. So keeping an open ear to both ends of the conversation, listening to the nurses and not just like brushing it off, answer your phone. I'm just kidding. But yeah, I think just being open to what the nurses are doing, what they have to say, and being just overall respectful. So it's such a simple thing, but unfortunately, some do. Most do, but some kind of forget that.
What are your future plans in nursing?
I'm still trying to figure it out. Right now, I am really liking labor and delivery. So I definitely think I'm going to stay with that for a few years. But after that, I'm kind of debating whether I want to get my women's health nurse practitioner or like go the nurse administration route. We'll see. I've also thought of maybe trying NICU nursing just to like see. But like I said, I'm kind of liking labor and delivery right now, or the travel nursing route too. That I'm also thinking about.
Last question, which I hope you could think of a fun response to this one. So if you could have a superpower as a nurse, what would it be and what do you think would really be beneficial for you?
Superpower as a nurse. Oh my god. I think just maybe if I could just like snap my fingers and like alleviate like pain, especially during labor, like make life so much easier. The first thought in my head just like being able to just like stop pain like immediately.
Wow. Stop paying for your patients, right?
Yeah.
Yeah.
Um
That's a really cool response, actually. I was
too, but yeah, paying my patients, especially if they're in labor. And I've had some cases where an epidural didn't work and they're screaming through the pain and you can't really do anything because nothing you're giving them is working. So that, or if I could just like grow multiple arms to do like multiple things, or clone myself. That's another. Like if I could clone myself so I can like stay in a room but also like grab things if like someone else isn't available to get things for me, that would also be pretty beneficial.
Yeah, I love your response because I was thinking like what you said after the growing many arms or cloning yourself, because that's more of like a benefit, an advantage for you. The fact that you said like alleviating pain for patients, that's a very like altruistic thing to say. So that was pretty cool.
It does also make my life easier when they're not in pain.
Yeah, that too. But yeah, cool.
Do you have anything to add that maybe something that you want our listeners to know about and that we didn't cover?
Well, I guess something is like if you're thinking about, either going into an accelerated nursing program or a 4-year bachelor program, whichever program you look if you can get a course description. Because something I didn't know when I started at UC Irvine is you didn't even take a nursing course until your junior year. whereas some colleges you start taking nursing courses your first year. And so definitely look into the courses when they start taking nursing, mainly especially for 4-year programs. When do you take your first nursing course, or is it mostly science-based prereqs for the first 2 years? Keeping that in mind.
And that is it for our episode on Tina's nursing journey. Thank you so much, Tina, for your time and your insight on being a nurse. And thank you all for listening, and we will see you guys next time.